And we want to welcome you to today's session, Getting the Most Out of Your Health Insurance as it relates to prescription drug coverage. I want to introduce April to our conversation. So good afternoon, April. Thanks for joining us.
Thanks for having me. I live in McAllen, Texas, and I have almost 17-year-old daughter. She was very healthy up until 6 years old, and she developed intractable epilepsy overnight. Within a week, we were in the ICU. And so we have been on an odyssey looking for her cure. We've done a lot of brain surgeries. We've done CBD, everything. You name it, we have tried it. Best advice I could give to anybody. If you are on an employer-sponsored plan, go to your HR department and ask, does our insurance broker have a team that can help me navigate this? And they'll help you with everything from your EOB doesn't make sense and you weren't billed properly to, oh my gosh, I can't get my medicine. And this is, for my daughter, she cannot miss a dose. It is life-threatening for her to miss medication. So it's not something I can sit back and say, oh, I'll get it, I'll work on it tomorrow. My broker, she frequently is on the phone. And so rather than me having to sit on the phone with Blue Cross for hours and hours and hours, they have a team that will do that. And they'll call my doctor. They are often more capable of getting a hold of somebody. When an insurance representative calls, they kind of get passed through a lot faster. And so they are so helpful in coordinating the paperwork that needs to be completed and getting that to the people who need it in order to make that approval. If you have a broker, become their buddy, get to know them. If you do have a life-threatening condition like seizures, make sure you communicate that to your pharmacy staff. Make sure they know you're not being crazy over like acne medicine, because they're filling hundreds of orders a day and they don't necessarily focus on what it is that you need and why you need it so bad. So, when I start using words like this is life-threatening, they start to kind of get a little more concerned and make those phone calls a little more urgently.
If you're the benefits manager at your family business, have you had issues working through limited drug formularies and trying to make sure that the drugs are actually going to be covered by the plans you're getting?
We have had that very unpleasant surprise that all of a sudden one of her medications was not on the plan. There is paperwork you can file called exception to care. And you as a consumer can go all over your insurance company's website and probably not really be able to find it. So you probably have to call in and you have to say, I'm on this medication. It's extremely important. I need to file exception for coverage. It will go to your doctor's office. They have to fill it out just so and get it back to your insurance company. But every time we've done it, we have received that exception. It's painful to see people who think that, well, I just can't get that medicine. What am I? And you go into a panic and, it's despair. You can't get the medicine, but there is a way to get it. So be persistent and call that insurance company, but use that word, exception paperwork. Building a personal relationship with your pharmacist, I really highly recommend, because then you're somebody that they're thinking of when they go through and they are doing their inventory. This year has been really hard for a lot of us because once the pharmacies had to start giving out the COVID vaccines, my pharmacist told me straight up, he said, this is my fault. We did not inventory as diligently as we should have this year. I've just been so overwhelmed with how many vaccines I've been expected to give. And so having that personal relationship, he then got on the phone. He called his pharmacist buddy at another place and he said, they are holding it for you. I got down there and they weren't going to give it to me until I told them, no, my pharmacist said, and they said, oh, you're the lady. Okay. So, if you can build that personal relationship, it really can pay off in spades later on when just that bizarre fluky thing happens. If you're being seen for a chronic condition, there's a decent chance that your doctor can hook you up with a social worker who can help you navigate this sort of thing. But yes, there are coupons that you can get. There are ways that you can get that medication. Now, if it's, for seizure medications, like we won't even switch manufacturers for the same drug because it's so finite. But if it's a new drug, you can always go back to your doctor and you can say, this is not covered by my insurance. Is there a comparable alternative? And there just might be. Frequently, there is one that they can prescribe to you that will likely be covered.
Thank you very much for joining us today.
Thanks for having me.